Welcome to this pair distinguished lecture. My name is Qingyan Chen, the director of the Purdue Academy for Interdisciplinary Research. PAIR was established 2 years ago, and currently we have 11 research institutes and 6 research centers focused on 3 major themes of research, such as sustainable cities, advanced technologies, and health and well-being. And today's lecture is about health and well-being. In the past 2 years, PAIR tried to address the major societal challenges, and health, of course, is a very important aspect of the health. And take last year as an example, the university gave us about 150 million Hong Kong dollars to PAIR to support all the researchers. On the other hand, the PAIR researchers gain additional 600,000 Hong Kong dollars from outside, and this really make a huge impact. We publish over 1,000 research papers. We also have developed many patents and knowledge transfer. So today, we are very proud to have Professor Lixing to give a lecture. I'd like to introduce the speaker. Professor Lau is a professor and the president of Virginia University of Integrative Medicine, or VUIM, from the United States. He has been a licensed acupuncturist, educator, and researcher for over 30 years, and is very reputable for his research on acupuncture and other forms of Chinese medicine. And we are very proud that Professor Lau is also a fellow of PAIR. Professor Lau is an elected vice president of the World Federation of Acupuncture and Magazine Societies. Before joining VUIM, Professor Lau taught family medicine and at the Center for Integrative Medicine of the School of Medicine at the University of Maryland, Baltimore, from 1992 to 2013. And then later, he served as the director of the School of Chinese Medicine at the University of Hong Kong from 2013 to 2019. At Maryland, he established a laboratory of the traditional Chinese medicine research to conduct basic science studies on acupuncture and Chinese herbal medicine. Professor Lau proactively drives acupuncture excellence with his many contributions and professional engagement. His research on acupuncture is credited with helping persuade of the Food and Drug Administration to recognize it as a medical device in 1996. Professor Lau is currently the editor-in-chief of the journal Integrative Medicine and serves as an editor board member and associate editor of several other journals. He was a board member of various government bodies and also including the Chinese Medicine Council of Hong Kong, the Food and Health Bureau, hospitality authorities, etc. Professor Lau's translational research bridges basic science, clinical trials, and clinical practice. He has published about 300 journal articles and 20 book chapters, and has delivered over 300 presentations at local, national, and international conferences. He is the principal investigator and co-investigator of over 20 studies funded by government bodies in Hong Kong and the United States. Professor Lau's contribution to acupuncture and oriental medicine had attracted many recognitions. Among the many honors, he received the Hong Kong SAR Chief Executive's Commendation for Community Service in 2019, And she won international award from China Association of Chinese Medicine in 2015, the Science and Technology Award, the third class from the Shanghai government in 2016, etc. So without further ado, ladies and gentlemen, please join me in welcoming our distinguished speaker, Professor Lixing.
Thank you, Rudy. Thank you very much for Professor Chen's kind introduction. And also thank Per and Polytech University in Hong Kong to invite me. It's my privilege to give a talk in a very nice, beautiful university. Thank you very much. So my topic is mainly for the, you can see the title is from the exploration to accessibility in the United States. So when I prepared the slides, I was thinking about my career, exactly 30 years. I graduated from 1992, now it's 2023. Reminds time flies so quick. But also I witnessed the development of acupuncture in the United States and also in Hong Kong and other places. So by saying that, let me start my PowerPoint. So outline what today's talk mainly discuss about the past, present, and future, and also discuss the East to the West. And also I discussed the milestones of acupuncture development in the United States. And each one lead us to a new level of the development. And also in more recently, evidence-based medicine emerged. So this also played a large role in development of acupuncture. And also I mentioned majority of my career in University of Maryland played a role in this development. And also discuss about the collaborations, including PolyU and Chinese U and Hong Kong University, and also dissemination of the information to the world. And maybe if we have time, we can discuss the future direction a little bit. So past, present, and future. So here, the past, you can see the ancient literature, you can see we talk about the yin-yang balance, we talk about acupuncture and qi in the meridians, and open the energy, the channel to alleviate pain and balance the body. But now, more people talk about the neural pathways activated. We talk the neurotransmitters, the hormone released by acupuncture needles. So there's difference. The modern science really play a large role in acupuncture development. In the East, we see lots of traditional way to treat patients using acupuncture, moxibustion, or different techniques. But in the West, they still new relatively. You can see the cartoon, the above said, my headache is gone, but I have lots of pins and needles in the body. And also the bottom slide said exactly what school you are graduated from. So this causes lots of pain. It's a joke of the cartoon, lots of cartoons in the United States. So actually, if we look at the history of acupuncture in the United States, not very short. It can trace back 200 years ago. So 1826, there's a journal called North American Medical and Surgical Journal published a paper by Frank Bake. He observed over the 20 different patients about the back pain, musculoskeletal pain. And his conclusion is that my impression is acupuncturation possesses remarkable power in removing and mitigating pain. So this was the conclusion, but this was almost 200 years. By 2026, it marked exactly 20 years. So we're going to celebrate. So then really acupuncture became very popular is after the President Nixon visited China in 1971. So one of the journalists of the New York Times, James Reston, he wrote a paper on his own experience with acupuncture after he had appendicitis surgery and for the post-operative pain at that time. So his report in the journal really triggered a big wave of the acupuncture. Then acupuncture became very, very popular. So then if we look at the development, the three milestones we can conclude. One is 1997. After 1970s, lots of people start to use acupuncture. FDA step in, said we have to label acupuncture in a certain device. They call investigational device, which means you only can be used for the experiment because no sufficient evidence to support acupuncture can be used in medical usage. But 20 years later, 1996, FDA reclassified acupuncture needle as a medical device. That means sufficient evidence support acupuncture can be used, legally used in any medical service. And 1 year later, National Institute of Health held a consensus conference on acupuncture, discussed in a bigger scope how we can evaluate the acupuncture and the usage and the research in the United States. So we talk about this, we have to mention the very important step. In 1992, United States Congress ordered the NIH to establish an office called Office of Alternative Medicine. The annual budget only 2 years, very small office. But then very quickly in 1999, the NIH promote the office become National Center for Complementary and Alternative Medicine. And 5 years later, 2014, NIH renamed center becomes National Center for Complementary and Integrative Health. So annual, the budget will become 183 million. Now it's bigger, now it's a very big budget. They found a lot of studies. So then about the Office of Alternative Medicine, they held when the first thing they did is have the workshop with the FDA to reevaluate the acupuncture usage in 1994. Okay, this was 1994. I was honored to be invited to talk, present our prior study in this workshop about the arthritis pain. Then in 1 year later, after acupuncture reclassified become medical device, and actually held a consensus conference on the November 3rd to 5th, 1997. In this conference, I was honored to be invited to give a talk, discuss our findings on acupuncture for dental pain and dental post-operative pain. Is the paper we published. So then the conclusion of this NIH consent conference, their summary said the clear promise evidence show acupuncture can treat adult post-operative pain, post-operative dental pain, and nausea vomiting. And also some promising evidence show acupuncture can help with the menstrual cramps, tennis elbow, arthritis, so forth. But the difference is that this study, even though it showed a positive study, but the research methodology not sufficient. So it's a weak methodology. So they call more research should be done to confirm the findings. So this statement and the conclusion in this statement says acupuncture is widely used in the United States. They recognize the factors. And also they said many studies provide equivocal results because of design, poor design, because sample size too small and other factors. And they suggest that further research should be encouraged to uncover more useful for the acupuncture. And they also encouraged more study on mechanisms of action of acupuncture to be studied. So since then, the NIH provided lots of the funding for the acupuncture research. This slide is obtained from the Richard Nahi from the NIH about the funding. Since 1997, over the 4,000 RCT randomized clinical trials have been published worldwide. So you can see that this very triggered bigger stimulation of the treatment. So I have to talk about our university, the Center for Integrative Medicine in the University of Maryland, where I work there. This center established in 1992 in the University of Maryland Medical School. Okay, so same time as the Office of Alternative Medicine established. So we very much catch time. So this is the location of our center in the red building. So what we do is first we provide a lot of service, outpatient service and even inpatient service. We collaborate with, similar to the pair, have multidisciplinary collaboration. We have lots of collaboration with the cancer center, with the heart center to provide acupuncture, herbal medicine, massage, and mind-body exercise, and all different nutrition to the patient in these cancer centers. And also we provide service for the shock trauma. It's only shock trauma in the East Coast of the United States. They save lots of life in the injuries, okay, then have the helicopter landed to the roof. So we provide acupuncture for the pain control in this with lots of service there. Then also we have very successfully obtained lots of grants from the National Institute of Health. Okay, so name of them, a couple of the larger grants I want to mention. In 1999 to 2004, 5 years, we have the grant called P50, the large grant, the Center for Excellence of Research on Complementary and Alternative Medicine. We have 3 products, and Dr. Brian Berman is one of the project leader. Dr. Marjorie and I was the leader in the animal study on the mechanism of action. So I have projects. Then after this, we successfully renewed the grant from 2005 to 2010. We have Brian Berman and I, principal investigator, receive another funding, the funding called Center for Arthritis and Traditional Chinese Medicine. So this collaboration with the Harvard Medical School, McLean Hospital, and the University of Illinois. Okay. Then we have the 3 projects and 3 courses. So we try to establish the strategy of how we move forward with the research. So one strategy we call phase-by-phase approach. And second one, we want to have use rigorous scientific research methodology, but still preserve the essence of TCM practice. And meanwhile, we want to maximize the TCM effectiveness within the scope of the rigorous Western scientific research. So to match both, okay. So by saying that, we just step by step. First, we use the FDA guidelines, phase 1, phase 2, phase 3 research approach. And first we start feasibility study, use a logical sequence. Then also we choose adequate anecdotal clinical information, and further we conduct literature research, and also then we conduct a pilot study, pilot study. Then based on the findings of pilot study, we calculate sample size, and also we interpret the different results. So here's a very quick review of the FDA, the phase 1, phase 2, phase 3. Everybody familiar with that. So we follow this similar step approach. So here we also address the challenge of acupuncture research. This big challenge we already know. So one is the most difficult is how to design adequate control, because acupuncture very difficult to double blind. Okay, how to make sure patient get acupuncture needle does not know what they get. So this is the challenge. And second challenge led by this first challenge is the blinding issue. So how can we make sure nobody knows what the treatment assignment they received, and also lead to a concealment. All the nurse research practitioner knows does not know which group assignment. And also for acupuncture research, Chinese research, and medicine research, we mainly aim to the symptoms, not disease. So this is another issue. Which targeting disorder is the most appropriate for acupuncture research? And lastly is also important, the quality control, how we ensure the delivery of the acupuncture needling technique from different acupuncturists to be same, okay, similar. So this is another challenge. So to address this issue, we established a 2 pain model for the study we started with. One track is called acute pain. We used the post-operative dental pain model. The results eventually published in 1999 in JAMA's archives of otolaryngology head and neck surgery. The second track, we follow the chronic pain. We use knee osteoarthritis. It's led by Brian Berman, Dr. Berman. So we published the paper in 2004 in Annals of Internal Medicine. So we can demonstrate that acupuncture not only can for chronic pain, but also for acute pain. Then the contribution of the center, we have two contributions. One is that we first reported and developed the placebo acupuncture using a sham acupuncture device. Then we can address the challenging issue, which how we design adequate control. This is the control we're using. So you can see we use the regular acupuncture needle. We remove the needle from the guiding tube. And we tap the tube on the surface and create a sensation. The patient feel like they have needles, but the patient cannot see the procedure. Then we use the guiding tube to manipulate the skin, make patient feel like they get some sensation. Okay, that's how we make this possible. And also we validate the results. We ask a patient whether you know what kind of treatment you get. So we successfully conduct a study. So here, a typical example of the treatment, the placebo control. So the patient, the vision is blocked by the screen. They cannot see what's happened in the area. We can perform either real acupuncture or placebo sham acupuncture there. And then we have the first step, we just conduct a pilot study with 12 patients, only open study, no control, just see how it's going, see the efficacy and tolerability about the patients. We have twice a week for 8 weeks treatment. And we see that we find that the patient reported pain decreased and stiffness also improved, and also the physical function also improved. So this is the findings. So we get excited and published the paper in 1995 in Arthritis and Cartilage. In the second phase, based on finding of the pilot study, we designed a large study, 73 patients. And then we use that point to compare to a control group, standard care. Then we find out the findings in pilot study is confirmed by this study. Also, we use the same treatment, but have a sustainable effect. This paper published in 1999 in Rheumatology, the journal called Rheumatology. So these results of the study, you can see the baseline, both groups very equal with the pain, with WOMAC, which is Western Ontario McMaster Osteoarthritis Index to measure the patient. So then 4 weeks later, the red bar acupuncture treatment, the pain significantly decreased compared to control group. Then 8 weeks, the pain continued to reduce. And even 12 weeks, 4 weeks after the end of a treatment, the patient still remains the pain less compared to control group. So in the function area, yes, this is a disability measure. You have similar results. You see, after 4 weeks and 8 weeks, the disability score much improved in the acupuncture group compared to the control group. So this study. Then we designed a large study. We submitted the results into the NIH, received large funding. So principal investigator, Dr. Brian Berman. So we designed a study, multi-sited, 570 patients with 3 arms, real acupuncture, sham acupuncture, and attention education control group. So multi-sited, the patient randomized by computer, outcome assessor blinded to the group assignment. So we use, you can see from this flow chart, very evenly distributed 3 groups, and they have similar content as twice a week for 8 weeks, and once every other week, and once a week and every other week, and every 4 weeks gradually. And so totally about half a year. So the treatment points, we use the fixed points, 5 local points. So in the knee area, and also 4 distal points, we address the TCM about the deficiency of the liver, deficiency of the kidney in TCM point of view. So the outcome assessment with the WOMAC osteoarthritis index, so pain and functions subscale. And also secondary outcome assessment, patient global assessment, use SF-36 for the quality of life, and also 6 minutes walking distance and adverse effects. So, the results you can see baseline very equal between two groups, no difference. So our randomization was successful. So in terms of age, gender, the race, education level, and the pain level are similar in both groups. So results you can see that the one-maker pain score, acupuncture the bottom line, in the 14 weeks, acupuncture shows significantly improved compared to sham acupuncture in the middle line. Of course, compare the education group more. But this the pain reduction sustained all the way to the end of the 26 weeks, half year. So this is the function score. So 8 weeks, patient to start to feel improvement. See the 8 weeks, 14 weeks, and 26 weeks. The summary is that treating Chinese acupuncture is effective for reducing pain, improving physical function in pain with symptomatic knee osteoarthritis who have moderate or great pain despite background medical therapy, and is safe and well tolerated. So this study published in the Annals of Internal Medicine. So then I want to introduce that many other studies be published at that time. We are the only one of the study during that time with many large clinical trials. So in 1912, the group in the Memorial Sloan Kettering, the cancer center, led by Andrew Vickers, they published a paper, large paper for the meta-analysis, the large law data. So they want to find a definitive answer whether acupuncture really can help the chronic pain or not. So this paper published in JAMA Internal Medicine. So background of this study was that although acupuncture is widely used for chronic pain, there still remains considerable controversial as its value. Okay, so they want to determine the effective size of acupuncture for 4 different chronic pain, such as back and neck pain, spine, and osteoarthritis, chronic headache, and shoulder pain. So they use the method, they search widely, search the literature from 955 total record. They find 29 studies, high quality studies. So then they used requested law data from each investigator from all these 29 studies. And all the results reported in the RCT publication, they will reconduct the statistic analysis, replicate it, and make sure, assess the quality of the blinding for eligibility to be included in the analysis. They also use the sensitive analysis included only RCT with a lower risk of the bias. So make sure all the study include the high quality. So results, they have 29 useful raw data, including total of 17,922 patients. Patients in all randomized control trials have access to analgesics and other standard treatment for pain, and drop rate was very low. So they have 2 different kind of control group. One sham control with needle insertion control, sham device, or non-needle insertion. And they also have a non-acupuncture control group, which is usual care, Western usual care, conventional treatment. So here the results, you can see say for the middle line, in the left side, you usually show the control is better, the left side. The right side, acupuncture is better. So all the dots you can see fall into the right side, indicate acupuncture far better than control. So this control is compared to the non-acupuncture, usual care, Western medicine treatment. So this next first plot compared to acupuncture with the sham acupuncture also show acupuncture seemingly better than the sham control in all 4 different kind of the chronic pain. So what it means, if we look at the results for the statistical results, the effective size, you can see for them, for neck and lower back pain, about 37% effect size compared to sham control. But if we compare to usual care, which Western non-acupuncture control is 55%. Then if we compare to arthritis, 26%, chronic pain, headache, 15%, and for shoulder pain, 62%. It's a large effect. So we still don't know what it means. Okay, but if we compare to the drug study, if this study published in the osteoarthritis cartridge in 2010, you can see they used the meta-analysis to analyze the pain medicine called acetaminophen compared to placebo. They found the effective side between 21% to 14%. Okay, but if you only use a high quality clinical trial, rule out the high risk the RCTs, they find that the effective size is 10% or 0.1, which means no difference. That means acupuncture no different than placebo in this analysis. So you can see if we go back to look at acupuncture, they have minimum 15% effective size, maximum of 62%. If we compare this, then far better than acetaminophen, Tylenol. All right. There are also more recent study published by JAMA by the group in the Columbia University. They want to see whether acupuncture can help the joint pain related to the aromatase inhibitor among women with early stage of breast cancer. They compare to sham acupuncture compared to waitlist treatment. They want to answer the question whether acupuncture can help the joint pain in this group of patients. So you can see 3 groups, evenly distributed 3 groups, and they treatment 12 sessions within 6 weeks, 6 weeks, twice a week. So then they follow up another 6 weeks. So you can see very quickly, see the table, all the circle, the red color means significant, p-value smaller than 0.05. So in all different kind of pain measurement, what's the pain, average pain, pain interference, and pain severity, all acupuncture better than control in 6 weeks and also the 12 weeks. So then let me switch to the basic science study we conduct. I only use 3 slides, not too much time. So maximum analgesic effect. The major challenge for acupuncture research on animals is called stress-induced analgesia. When you restrain animal, when you put a needle in the animal very stressful, then we produce different like adrenal. Okay, this could cause the pain reduction. So how to control this challenge, decrease the stress-induced analgesia? So we developed this another contribution. We first report using non-restrained animals. So you can see animal very relaxed, like in the clinic, not restrained. So but in the cage, they can move around. We connect to electrostimulation. So if we look closely, they usually fall asleep during the treatment, during the acupuncture treatment. So we rule out the possibility or minimize the possibility of the stress-induced analgesia. So the results of this model we published lead to many, many publications. So in the end, we have the summary review paper also including our findings. So this picture just show you the study showed that acupuncture triggered the central nervous system to trigger HPA axis, which is produced in the beta endorphin for the pain control. It also can trigger the corticosteroids, so for suppress the inflammation. So this study published in the paper in the 2014, the anesthesiology, the journal called Anesthesiology. So then we talk about collaboration and dissemination by center. So here we another funding at the same time, and we get a large grant funding is with Hong Kong, okay, familiar with International Center for Research on Complementary and Alternative Medicine. This was the co-investigated by Brian Berman and Joseph Song, you know very well, in the Chinese University of Hong Kong. So that time I traveled to Hong Kong almost every year. And with University of Maryland, we also involved the University of the Illinois and University of the Western Sydney, Ellen Benso's group, and also Dr. Helen Fang's group. And so we have 3 projects and 3 courses. You can see we have urban clinical trials. We have you can see the admission call charged by Dr. Brian Berman and Joseph Song, and also ERPCO will have the CT, Professor CT chairs here. So he also contributes to this the study, as Justin Wu also was work with me on the animal study. And also, I want to mention this slide. I know people are familiar with this slide because this type and the strength of the efficacy, or strength of the evidence. So our CT, you can see the top, and systematic review or meta-analysis on top, strong evidence. So lots of evidence show that acupuncture is very effective and safe. So this important is to now we talk of the evidence-based practice. So we practice based on the evidence. So now larger practice in the United States based on the evidence. So let's see the results. See lots of news media covered our studies. You see all Newsweek and all different kind of BBC or covered the story of our research. So bigger impact. So then also Washington Post published the paper on my research on the arthritis, and also New York Times also published. So these have very big influence the community. So then affect the medical community and also public at large. So then recently, like last year, 2022, in Times Magazine published a paper called Why Acupuncture Going Mainstream in Medicine. So this also indicate the influence, okay. So you can hear in the United States, acupuncture usage in 42 hospitals already. But maybe in China, maybe not it's easy to understand. But in China, in the United States, before very few hospitals will use acupuncture. Now we have at least 42%. So among these, the 6 very popular alternative therapy, acupuncture ranked number 2, most popular treatment in the hospital. Number 1 is, of course, massage therapy. I really like massage. So the accessibility expansion, now acupuncture is legalized in 45 states among the 50 states. And all the medical doctors can use acupuncture needles now. And the physical therapy in 39 states can use acupuncture needle as a dry needle now. And most medical insurance covers acupuncture now. And the federal in 2020, federal government, Medicare, they begin to cover acupuncture for low back pain. Okay, this is just starting. So again, to more evidence show the effective acupuncture, useful of acupuncture, and I believe will be more accessible to the patient. So then if you look at the website of the well-known cancer center, Memorial Sloan Kettering Center, there, if you see the bottom, red color acupuncture, one of the service they use. If you look at the MD Anderson Cancer Center, acupuncture also one of the service they provide. More Johns Hopkins, acupuncture and Chinese medicine be used as their service, and Harvard Medical School acupuncture top list of their service. You can see many hospitals start to use acupuncture for their patient service. So then also the development in the United States, in 1999, the 8 universities, including University of Maryland and Harvard Medical School, we formed a consortium. Then now this consortium developed into 75 members at least, including the university from Canada, from Mexico, from Australia, from Brazil. We formed a consortium of academic consortium for integrative medical medicine and health. So they held an annual conference to share the experience with research, education, and clinical practice. Become very powerful. So then also almost 40 of the clinical practice guidelines recommended acupuncture to be used, including some back pain, neck pain, also the cancer, breast cancer, many the guidelines being recommended. So near future, so I look at the website and I showed NCCIH, they said what area they want to first the high priority. They want to encourage more pragmatic clinical addressing where the acupuncture should be incorporated for the clinical pain management, because we know in the United States we have the opioid crisis. So the pain management is a major urgent issue. So then also does acupuncture a comprehensive pain management approach, including availability of acupuncture, improving pain management and reducing opiate usage. So, but lower priority, they said research compare real acupuncture and sham have not encouraged them because enough studies show we don't have to waste the federal money. And also research compare individualized acupuncture and standardized acupuncture is not useful. So they don't encourage this kind of research. And recent findings which are received, but now we focus on acupuncture points. So this is a topological atlas and repository for acupoints research. Multiple, this just founded last month, November, by Vitali, Harvard Medical School, Richard Harrison from University of Michigan, and he later moved to UC Irvine, and also Carl from the medical school. This was from 5.8 million for the 5 years from 2023 to 2028. So I'm invited as a consultant for the founding. So then I want to introduce the Society for Acupuncture Research. I was served the co-president of Society for Acupuncture Research from 2003 to 2007. This is the picture taken in the Harvard Medical School. We had a retreat there. So, and also we have very actively have annual conference. And this next year, we're going to have annual conference in collaboration with Paul Yu. So this advertised for Professor Wang and Jerry. So we're going to certify acupuncture research, and Paul will co-sponsor the research conference in May 23 to 25, 2024 in Hong Kong. So welcome everybody to join us. So the title of this conference will be Bridging the Two Worlds, Engaging Traditional Chinese Medicine in Modern Health Care. So I hope you enjoy us. Thank you very much. I'll be happy to answer any questions. Thank you.
Thank you, Professor Lau, for the inspiring talk. Now we would like to invite the two panelists to the stage. So we have Professor Peter Jiang Xipeng. He was trained in Australia in neuroscience, and then his research is also related to acupuncture. And he has been involved in establishing the Chinese medicine program in the Hong Kong Baptist University. So he has made significant contribution to the field. And the second panelist is Dr. Lin Wei-Ling. Trained in Hong Kong U in acupuncture and moxibustion. And then he finished a PhD in Guangzhou University of Chinese Medicine. He's now working in the School of Chinese Medicine and the Hong Kong Institute of Integrated Medicine of the Chinese University of Hong Kong. So both are very renowned researcher in the acupuncture field. So we would entertain any questions. So if you are online, you can type the questions, and we would start with the Q&A first. The first question is from the Zoom. The question is, I myself have been receiving acupuncture treatment for over a decade due to chronic lower back pain and spot injuries. I feel that the acupuncture has become an intensive business in Hong Kong, but the quality and hygiene really varies. So how can we address the quality assurance? So Professor Lau, panelist.
Thank you. It's a very good question. I think it's a very important question as well, because I served the 6 years in Hong Kong as the Chinese medicine panel. For the controlled licensure, it's one of the concern always about safety of the patient. So I introduced the so-called CNT, clean needle technique from the United States. I'm instructor. So when I was in Hong Kong, we offer the workshop for CNT to make sure the safety practice. So in United States, actually, every licensed acupuncturist must pass the CNT examination. So pass the examination, then you can able to practice. So they very clearly, step by step, how to prevent the infection, cross infection, also prevent the puncture needle into the organs. This safety they very much emphasized. I hope we can continue to work on this area.
So Professor Lau, you mentioned that in US, all the medical practitioners are allowed to use the needles for acupuncture, right?
Yeah.
So do they, I mean, they are Western doctor, do they receive training before they can use the needles?
There are questions. Now, legally, every medical doctor can use acupuncture needles. However, reality is that there's a society called medical acupuncturists. They have been training at least 200 hours in the UCLA program. They have training, minimal training. Then they have every year they have intensive training workshop every year to enhance their skills. So these medical doctor can use acupuncture. But to my understanding, very few people really go to practice acupuncture. They too busy with Western medical practice. So they give the needle just for free. They don't even charge the service of acupuncture. So there's not much impact of the acupuncturist in the United States.
How about the Professor Zhang? So what do you think about the quality assurance of acupuncture in Hong Kong?
I want to start by congratulating Professor Lau's achievement and his great presentation. And it really outlined the whole development of acupuncture, both in the United States and a little bit in Hong Kong. And the audience certainly asked a very good question. That is the standardization of clinical practice, which also relate very closely to the topic of today, which is the accessibility. Perhaps due to the constraint of time, Professor Lau has not been able to elaborate on this issue. And in fact, I think Hong Kong has a great role to play in the standardization of acupuncture practice. In terms of training and in terms of the procedure, because Professor Lau is an expert in designing clinical trials, and a scientific study must have a standardized intervention. Although I did hear Professor Lau said that also taking into account the characteristic of Chinese medicine practice, having some elements of individualization, but this could also be written down. What has to be standardized and what can be individualized, and this can also be well documented. And in relation to this, I think that PolyU have a good role to play since Professor Lau has been invited by PolyU by the pair, because PolyU is very strong in instrument development, and a lot of the practice are related to design of the instrument and also the use of instrument. And by I think collaborating with Professor Lau and also the academic the academic networks in Hong Kong, we can achieve a lot in standardization of acupuncture practice. So thank you for the audience for asking the question. And Professor Lau, would you be elaborating on this as well?
Thank you. Thank you for the good question. So I think the quality, and also I think first of all, the PolyU established pair is very timely. It's a time for reach out. We not limit ourselves in the acupuncture community. We can have multidisciplinary together, work together, and can enhance forward the research acupuncture. I think this is very important. But for safety part, I still encourage Hong Kong can adopt the CNT course in the United States. So everybody have to pass this. I think it will be ensured that at least the knowledge, you have knowledge on how to prevent the adverse effect.
So Professor Chung, you mentioned about the standardization. Well, I'm not an expert, but for example, if I have a lower back pain, and then I attend, I see a practitioner and receive acupuncture. Is there any personalization? Are we all receiving the acupuncture at the same set of acupoints?
I can share one research by Shim in the Seattle research group in low back pain. They have 4 different types of the acupuncture. One is the individualized, it can change based on condition. One is standardized, and the other 4 groups. Then if their results find no difference, the result no difference in individualized treatment or the standardized treatment. So in particular in this low back pain, no different. But other condition maybe. But in this study they showed. That's why NIH not encouraged to do any comparison research between standardized and individual treatment. So we very often we use the semi-standardized. The major protocol standardized, similar, but we change some points for different conditions.
How about Dr. Lin? Any comments from you about the standardization and quality control?
If we do the studies, I think all the things standardized, okay, especially in RCT. But in real practice, I think it depends on what disease we are treating, and also, in fact, for the same disease, because in Chinese medicine we talk about how to say, that means we need to see why the patients got, for example, low back pain, kidney deficiency, or the blood and qi deficiency, for example. I just meant this because in Chinese medicine, of course, we treat the disease. We see there are some standard acupoints we can use, but in real practice, if we see the patient have different conditions, different practitioners may maybe add some more extra acupoints on it. But I think all in Hong Kong, especially in Hong Kong, all the Chinese medicine practitioners, when we do the acupunctures, we are well trained. And also because I see that means the participants raised the questions about the safety. Even though the acupuncture, even though the needles are removed by the other, maybe our assistants, we need to make sure the number of needles, and also as the Chinese medicine practitioners, we can double check. Okay, double check to make sure the quality and the safety control. Thank you.
Well, there are many questions related about the quality, and also, so one of the participants asked, what should be done in terms of the licensing recognition for acupuncturists? Do we need a central commission or repository to regulate the market and ensure information transparency? Am I correct that in Hong Kong, the registered Chinese practitioner are the acupuncturist, so we don't have any extra, acupuncturist, which is not a registered TCM practitioner in Hong Kong? Yeah.
Physiotherapists who have should attend some course in acupuncture.
So we already have the licensing registration framework in Hong Kong and in US as well, right? Okay. The next question is, when it comes to acupuncture in Chinese medicines, how should we handle or recognize local and overseas qualification? Again, I think the registration already take care of that. The next question would be, when it comes to research, would the researcher and scientists enjoy a better prospect and funding opportunity in the West? Do you think there are more funding opportunities in the US or in European countries compared to Hong Kong?
Of course, and research you always enjoyed funding. If no funding, you can do nothing, right? So you have to have the funding to to conduct research. So if you in the universities, the major important driving force is funding. If you no driving force, you cannot publish papers. But the interesting that usually we, not just for funding, we do research. We really interested in subject. We want to answer the scientific questions. What we unknown, we want to dig in to find out what's real. For example, before the people raise the question where acupuncture is placebo effect, we really want to know whether it is a placebo or not. So you have to design a placebo-controlled study to clear the demonstrate acupuncture more than placebo. So that's what you enjoy for. And you find out really the results that come out to match your expectations is very exciting.
How about the two panelists? What do you think we have a good funding opportunities in Hong Kong?
Well, I think this is a very interesting question. In the past, it was very difficult to get funding for doing acupuncture research in Hong Kong because for basic research, we are competing in the GIF domain, and it is very tough. But for clinical research, I think we stand a fair chance in Hong Kong when we apply for HMIF. A situation I think has not changed much, but in Hong Kong now we have the Chinese Medicine Development Fund, and they also will fund mostly clinical research of acupuncture, I guess. So the number of funding, I don't have the exact figure, but the number of projects funded in Hong Kong are increasing in acupuncture.
Thank you. Yes, I think so. Since we now have Chinese Medicine Development Fund in Hong Kong, supported by the supported by the Hong Kong government, so that we have more resources to do the research in Chinese medicine, of course, including acupuncture. Yeah.
Okay. So we have entertained a few questions from online. So any questions from the floor?
Professor Lau, I learned a lot from your talks. And of course, there's a long journey, but you pinpoint some major breakthrough that you have bring along and move forward. Now, I also heard from the discussions that we actually, with polyuse strength, we can try to develop something to help improving accessibility. Now, my job is to promote interdisciplinary research, so as Professor Chen. Now, we need to have very specific, because out there, there's so many medical device acting on the acu, point already. What are the bottleneck? What kind of device that you think is necessary to be improved by technology, other than just purely downstream research? Because we are going to maybe we have other RI and RC that has different techniques that they could apply. So I need some kind of, enlightening on this part so that we can communicate with other RC and RI so that they could use the technologies to help, for example, pain management. I think that would be really something that we need to, not just the specialists, like even physiotherapists is specialists. So maybe we can educate some like people who are taking care, the primary care helpers to use. But what are the bottlenecks? How can we improve accessibility?
I think that's a very good question. I think you can see from NIH statement the acupuncture research reached the level that we have to more usefulness, accessibility for people who need. No longer the past period that we find out whether acupuncture works or does not work, how it works. This time is over. But now we see how available it is. Then you mentioned good questions, how to make patients easy to access to the treatment. So we discussed during a couple of days of staying in Hong Kong, discussed with many different departments. So one of the study used self-study for teach acupuncture by patient to acupressure. But for the elderly people, for sick patients, very difficult for push themselves. If we can collaborate, work, find out some device, easy for them to quantitatively control the pressure, control frequency, make optimal stimulation for the patient. It will be very helpful. And I think with the poly technology, you should combine lots of new technology between the, because we don't know yet until you meet together, then you figure out some new AI technology, many possibilities. I think you have very big future.
Introduction. I'm very surprised that the US medical practitioners can actually perform acupuncture. So I'm quite curious on how they actually learn acupuncture, because from my experience or from what I've known, like Chinese medicine talk more like the approach of treating a disease is very different from the Western approach. Like how they learn, it's very difficult to quantify or to have a measurable outcome, or how to measure their clinical efficacy. Because traditional Chinese medicine, for example, they talk about balance, but it is quite difficult to observe for beginner practitioner. So I'm quite interested on how they learn, or who can how they teach acupuncture, because different approach of acupuncture or different theories, they have their own aim or target, and it can be quite different in terms of outcome. Thank you.
Thank you for the good question. So first of all, I suggest you look at the website, the UCLA acupuncture program. They have a very detailed curriculum how to train the acupuncturists. Actually very large, have been many years so far. So lots of medical doctor, they graduate from medical school, they can have continuing education credits. When they meet a couple times, now they have more online. So then they have a theory as well as the practical, how to use the location points. But their approach is step by step. The beginning, they major points, they now learn 360 points. They learn major points, large intestine 4, right? It's most commonly points they use. Then they have every year, they gathering together, continue to learn, experience. So this also their usage more symptom management, not like TCM balance yin and yang. They don't learn much of deficiency of yin or yang or organ. They just balance the. They very much they use the muscle trigger point. For example, physical therapy use the dry needle. They use only a few hours training, but use the trigger point very well used in Western medical field. They put the needle into the trigger point, usher point we call. They still can have relief the pain.
Am I correct that they can, theoretically speaking, they can use the needle before they receive those training? Is
I'm
it-
sorry, the question.
So the medical
medical doctor,
practitioner, when they are already a practitioner before they receive the training on
they-
acupuncture, are they allowed legally to use?
If they're licensed, the Western medical doctor, if
They
they're
are
MD,
allowed to use,
They are allowed to
but
use.
they have no official training in their medical
Never.
training program.
In medical school, like a school, University of Maryland, they
Uh-huh.
have course to teach their the course mainly tells them what condition to go to refer to patient to acupuncture, not
Okay.
train them to use acupuncture. But as I mentioned, the UCLA, they have 200 hours course.
Mhm,
If you want to be registered medical acupuncturist in the state,
mhm.
you have to pass this course to be licensed, be registered.
Okay, I see.
But if somebody, but I never know case, if you are not registered medical acupuncturist, you still use needle, nobody sue you. Unless you get an accident, otherwise.
That's quite
you can-
interesting. I mean, in the regulatory point of view, but yeah, there's like questions there. The mic can give it, yeah. It's on already. You
It's
can-
on already. Okay, thank you. Oh, my name is Professor Yun Hong Chang from Applied Physics Department. So I'm very interested to know, I think I read some paper regarding using a laser pulse to stimulate the nerve. In fact, there's a lot of physical method can. I'm not expert in acupuncture. I'm not sure whether this non-contact physical method, for example, magnetic field, light pulse, ultrasound, can actually produce some effects as a needle. Is it in general, or in general, do you see any opportunity for the physicists in the acupuncture field?
I believe so, because if we understand what nature of acupuncture is really stimulation. If we put needle called mechanical stimulation, if you use more expression, the thermal stimulation, right?
Yeah,
So
yeah.
you can use electrical stimulation called electrical stimulation. So just different stimulation to stimulate the peripheral nerve. The peripheral nerve will send a signal to the brain. You incorporate the signal and to balance the yin yang. So I work with the research group in Shanghai. They use the infrared to treat patients. They mimic the acupuncture needles. They still can, but no pain, no invasive, and there's some laser acupuncture. They can they can use surgery even, right? If we have intensive, but if they very mild with the stimulation, you can use the acupuncture needles. It's possible, yes.
Is it working then as good as a needle? But why not people using it? Because there's a lot of advantage I can see. For
Yes.
example, I can wearing this device and have a continuous treatment rather than lay down on the clinics and.
So let me answer you the two questions. One is the way it works. They have lots of clinical trials compared to the laser acupuncture to the non-laser placebo control. They show the superior to the control group. This is demonstrated in the randomized clinical trial already. So this is number one. Why not use? It's too expensive. So
no.
either your device.
Now the laser
Make
is
something
so
very
cheap.
easier for
Yeah.
people use. Otherwise, you buy equipment just $2,000.
But needle you have to throw it away, right? Each time you use it and throw away. But laser you can use it many times, right?
No, the machine have to replace. You have to maintain the machine. Machine have to repair. You have to-
You got to talk to me. I have a cheaper way to do it.
May I add some points on it? Because I want to ask Professor Lau's professional advice on this. Because from the studies, we can see the shame acupuncture, right? Shame acupuncture, that means we also use the, that means the not penetrating into skin, the main difference between shame and the real acupuncture. So do you think this is, but we can see shame acupuncture also have some effects, but the true acupuncture, the efficacy will be much better. Do you think penetrating the skin is the main point for 得气, 得气 in Chinese medicine?
It's depends. I think mainly the amount of treatment, intensive treatment. If you not penetrate, you just press the body very strongly, you have same effect. Right? Acupressure, and yeah. So as soon as you reach the triggered activity, the nerve transmission to the brain, appropriate sensation, and reach the same. That's my belief, but they need a scientific approval also.
So we can also try to develop some device,
Yeah,
right?
that's right. Yeah, that's possible.
Testing. Thank you. Thank you very much for Professor Lau's inspiring talk. And thank you very much for PolyU and Pear for organizing this, because I think you can gather a lot of Chinese medicine and also people who are interested in Chinese medicine to have some inspiring discussions. And I'm very greedy. I have 3 questions to ask Professor Lau. The first question is, you mentioned about the pragmatic trial should be used in the research. But according to the evidence tower, is it still does it still have strong evidence? Because still systematic review and randomized control trial still being the top of the tower. And I'm just thinking, is it still worthy to do the pragmatic trial? And then the second question is, nowadays, because so many different acupuncture research, can be in Chinese medicine, Western medicine, or physiotherapy, and also medical doctors. I think there's a very wide research aspects in acupuncture. From your experience, which kind of acupuncture is more, is better to be more investigated, like Chinese medicine, or we should go modern and investigating the trigger points, or more on the systems or the mechanisms of the acupuncture? And the third question is, I heard that from the Chinese Medicine Development Fund, we have lots of money now. They have about $1 billion for Hong Kong to do research now. So how could we make use of this money to maybe do some more meaningful research with this money? Because we always feel that funding is a big problem in research. With your experience, with so many research, I think you will have some ideas for us. Thank you very much.
To be honest, actually the funding in Hong Kong better than the United States. It's much easier because the government gives so much money for the research and budget, but you have to be competitive, of course. The people who compete for the funding also a lot, but United States also very difficult to receive funding. Back to the first question, second question. Actually, this two is just opposite. So if we see my slides in the NIH, the priority for research did not encourage any study compare different style of acupuncture, because they find no difference, because all stimulation, different type of acupuncture, different type of stimulation. So it's no reason to spend time, because even though they have maybe slightly different, we cannot detect the difference with sample size, that limited sample size, right? If your margin is so small, even your lipids may be better. So then they encourage the programmatic study now. They want to see how real time in the real clinic, how you maximize the effect. Because in clinical trial and RCT, you limit yourself. You only use needle without any other condition, approach. Like you can use mock expression, you can use massage, for example. But in real clinic, we use all different to maximize the effect. So they want to see. So they put the TCM in the box, the whole, compared to the other therapy like a Western medical drug therapy, for example. This is called programmatic study. So far, evidence is very strong, very promising. If we search literature programmatic study, I haven't seen any negative study, all positive study, all good. Okay, you can look at it. For the McPherson in the UK for the neck pain, many studies he published in their group published. That's a positive study. Thank you.
Well, I just wonder, apart from pain, is there any conditions or disease which could be better treated by acupuncture, apart from pain?
Yes, there's a lot of research now. In the beginning, people focused on more pain because have been historically acupuncture using for pain, mostly like musculoskeletal pain. In the Yellow Emperor, in the classic, in the early, they said herbal medicine for internal treatment, for internal disorder, acupuncture for external treatment, for external disorder, so musculoskeletal. But then people realized lots of conditions can be treated by acupuncture. For example, NIH also in the statement said that acupuncture is very good in nausea vomiting, induced by either morning sickness or by chemotherapy induced post-operative nausea vomiting works very well. So there's many expand to different areas.
So how about the panelists? Do you have any experience or what other conditions can be treated by acupuncture?
Acupuncture is stimulating mostly, as Professor Lau has illustrated, the nervous system. And then through the stimulation of the nervous system, it also affects the endocrine system. So under this physiological reaction, obviously pain is the most applicable situation. However, apart from that, many of the neurological diseases, even recently I've treated some patients with very rare neural diseases, like the attack of the nerve myelin sheath due to COVID, or especially due to vaccination, actually. And it's also responsive in some cases. And there are other neurological conditions, such as nausea and vomiting is one of the, is mostly a nervous reflex. And also like insomnia. Me and Jerry, Jerry and lady is next to me, and they also involved in study of insomnia in Hong Kong U before. Probably Professor Lau is also involved as well. So and also for lots of the emotional problems like stress and anxiety. Also, many people respond to acupuncture very well. Then you have local effect, such as for eczema. Of course, eczema is a combination of both the local condition as well as the nervous condition. So yeah, there are many other areas that can be explored. Yeah. Perhaps Dr. Lin, you can add to it.
Okay, thank you. Oh, okay.
Yeah.
Hello, Professor Lau. Thank you for your sharing. You know, I am also a traditional Chinese medicine doctor, and now I'm measured in rehabilitation in PolyU. And when I do my master and bachelor degree, I was measured in acupuncture too, in traditional Chinese medicine of Guangzhou. Yeah, and I referred to your article several years ago. So what is so kind, so small? One question is that I want to ask is the occupatonomy. You know, as a clinical practice doctor, occupatonomy can also bring some good effects in the musculoskeletal disorder. But in Hong Kong, I know it's a great area. So I just wonder, when we do some research, I think it's we do some research like this one, because it also can bring a lot of clinical effects. And the second question is that, you know, in mainland China, there is also a professor called Tu Yihen. He spent a lot of effort in the brain mechanism. So do you also do some research about acupuncture, especially for the brain mechanism? Thank you.
Thank you. There's lots of research. I cannot do everything. But I really encourage younger generation like you to work more research area. We need the younger generation to, because we're all going to retire. So, so you should be, we really encourage more younger generation in this room and then in the audience that to promote your idea and lots of good ideas. So we never even think about this. Promote this. The brain research, lots of research has been done, particularly in the Harvard Medical School. They use image to see use MRI to do research. You can look at their papers and to see with collaboration. You need a machine to do the research with the other university faculties.
In the interest of time, let's entertain the last question. Kara?
Thank you, Professor Lau, for a very informative talk. I learned a lot from you. Okay, you know, to me, obviously under the umbrella of traditional Chinese medicine, acupuncture is one branch, herbal medicine is one branch. Now, in my opinion, I don't know whether I'm correct or wrong. To me, it seems like acupuncture is like one circle. Herbal medicine is one circle. And then, you know, like a patient, you go for acupuncture, then you also go for acupuncture, and then you choose herbal medicine is herbal medicine. However, you know, nowadays we talk about integrative medicine. Obviously, the term is talking about integrative Western and Chinese medicine. But to me, you know, today I would like to ask for your opinion. You know, should we have more integrative medicine just on acupuncture and Chinese or herbal medicine in the overall management of disease?
Yes, definitely agree. If you look at the history of Chinese medicine, many well-known Asian physicians, they use multiple skills. They can be like a Huatu, they be surgeon, get over this, the acupuncturist, they can do everything. So we don't limit ourselves. But actually in the United States, we license the acupuncture That means you can use herb. You still can use herb medicine. So, but in China, the Chinese medicine is top. Underneath the acupuncture is different. But means if you learn Chinese medicine, that means you can use acupuncture. You shouldn't use acupuncture. But in particularly in Hong Kong, we call the practice, the training, they should learn everything. The school of Chinese medicine in different schools, they teach you everything. They should learn everything.
Yes, I understand they teach everything, but we don't see much about research either in the integration. You show us the papers on acupuncture. We obviously last week we saw a lot of publications on herbal medicine, right? But I don't see much. Am I correct? I don't see much about research on the use of acupuncture plus herbal medicine in certain disease area. Am I correct?
Good question, very good question. Because I forgot, I thought you mentioned about practice, but for research, yes, that's true. Because we talked to NIH officer a couple of times, so we tried to apply the grant, but said it's very complicated. How do we know which works, right? If acupuncture over medicine, you don't. So in the Western concept, the pharmacological concept, they want to know very clearly which exactly. Even the herbal medicine, they want which component in the herbal formula. So this suggestion that you start each one first, then combine together to see any synergistic effect. So this is the approach. The research approach is different.
So that's the reductionist approach.
Yes,
that's
exactly. We have been
correct?
discussed for many years already. So before we start, I have answer one question, very good question, I think. The one question mentioned how to, the practitioners may not know about research, but the research, they're not practitioners sometimes. So how to fill the gap? How as the practitioners to use the knowledge in the research area? I think this is a very good question. So in the talk, I give many talks in the United States. This question comes again and again, because I always think it's nothing to do with me. I'm an acupuncturist, I see patients every day. Why I bother to know about your results? It's important. Now we teach our students it's important. You don't have to conduct research by yourself, but you have to understand the findings. You have to understand, interpret the results from the paper. You have to do very basic control. So in our school, we teach evidence-based medicine. The students already know, no matter in the future, they want to just be practitioners or become research, they have to understand. If we see the paper, doesn't matter, acupuncture paper, or herbal research paper, or even Western medical paper, you understand what it means p-value smaller than 0.5, which means control. That's very basic. You look at the abstract, you understand the research already, the whole entire paper. So this I suggest everybody acupuncturist, they don't have to conduct research, but you understand what people say. It's important because you can communicate with other medical field, right? You can communicate with insurance company. I give you a very quick example. One of my students graduates from the school I teach, and she had a problem with, she treated patient about 20 times, and the insurance company sent a letter, I'm not cover your treatment for neck pain because no evidence. So she come to me, then we search the literature. There are lots of research paper published in the acupuncture for neck pain. So we piled up about 35 papers, then write a letter to claim, appeal. There's lots of evidence. Then 1 week later, get all the money back. So this is important. The students from them know they want to learn this because can protect their practice.
Okay. So while in the because of the time limit, so we have to stop here. So let's thank Professor Lau and the two panelists again.